Going to continue with Corona false alarm. Nationwide lockdown. What impression would it make on the world if each federal state in Germany had its own rules? So the measures were hastily emulated throughout the nation. The stay-at-home command sounded too negative, so we were presented with a lockdown. On March the 23rd, in the guise of a 9-point plan, this meant nationwide confinement orders. A far-reaching contact ban was imposed. Congregation of more than 2 people in public were forbidden. Restaurants, hairdressers, beauty parlours, massage practices, tattoo studios and similar businesses had to close. Violations of these contact bans were to be monitored by a regulatory agency, and failure to comply was to be sanctioned. Penalty catalogues were hastily patched together. Some states went to extremes. Bavarian, Berlin, Brandenburg and Saarland, Saxony and Saxony-Anhalt enacted decrees that allowed leaving home and entering public spaces only with a valid reason. At the same time, hospitals were so empty that they were able to accommodate patients from Italy and France. On March the 23rd, the German Parliament announced an epidemic situation of national concern, so that every 2 days later the hurriedly compiled new law to protect the population during an epidemic situation of national concern could be implemented, largely unnoticed by the general population. It empowered the Federal Ministry of Health to determine by decree a series of measures that violate the first article of the German Constitution. Human dignity is inviolable. Okay. These political decisions were made in the absence of any evidence that might have justified them. It was for that reason that we decided to write an open letter to Chancellor Merkel, in which questions of fundamental importance were raised. The intent was to give the government the chance to turn back from the wrong track with dignity. But our opinions and those of many others who did not agree with the government line were ignored, and dissenting voices were discredited in the newspapers and the media. It goes without saying that we never received an answer. Instead, at the end of March, it was officially proclaimed that the virus was still spreading too fast. Case numbers doubled every 5 days. The goal must be to flatten the curve, so the doubling time is extended to 10 days. Only thus would we prevent the healthcare system from being overwhelmed. The contents of an international document of the German Ministry of the Interior, GMI, were then released to the public. There one learned that the worst case scenario forecast 1.15 billion fatalities if the virus was not contained. If we look at the numbers of reported infections in the first 4 weeks of March, calendar weeks, CW, we can see that this actually looks like exponential growth, exactly as the RKI proclaimed, and that is how it was presented everywhere. However, what the RKI did not point out was that in calendar week 12, the number of tests had approximately tripled and increased again the following week. The RKI apparently did not feel duty-bound to truth. The clarification towards the population, so therefore are these figures distorted? Why did they why didn't they correct the numbers? They could have been achieved by stating the number of infections per 100,000 tests as shown in the second diagram. So there is a diagram here, I don't know if you can see that. Okay. The RKI text should rather have read as follows. Dear fellow citizens, our numbers show no exponential increase in new infections. There is no need to worry. Indeed, the epidemic is literally over the hill, as you can nicely see from the R curve of the RKI, which was published on April the 15th in the Epidemiological Bulletin 17. What is glaringly evident, the epidemic had reached its peak at the beginning to the middle of March, well before the lockdown on March the 23rd. The lockdown had no effect, numbers dropped no further after its implementation. So there is a little graph there, if you can see that. April 2020, no reason to prolong the lockdown. How did things look in the middle of April when the decision of once again prolonging the lockdown was pending? Everything was really clear now. Just like the R value, the number of newly infected cases showed that the peak of infection had passed. Figure www.cidm online. The upper curve depicts the number of newly infected, with the initial increase as officially presented. The lower shows those numbers standardized to 100,000 tests. Column shows the actual number of conducted tests. The fact is that there had never been a danger of hospitals being overwhelmed because there had never been an exponential growth of infection numbers. I'll just show you that graph. Okay. There were thousands of empty beds. There was never a giant wave of COVID-19 patients, not because the measures were so effective, but because the epidemic was over before they were put in place. But all the hospitals postponed or even suspended all elective surgeries and procedures such as hip or knee operations or checkups for cancer patients. Many hospitals reported occupancy reductions of up to 30% and more. Doctors were put on short-time working hours. The lockdown is extended. On April the 15th, Germany extended the lockdown. The rule for social distancing and contact restrictions were prolonged. In public, social distancing of 1.5 metres were mandatory, and you were not allowed to go outside your domicile with members of your family and one other person. But you were only allowed to be outside your domicile with members of your family and one other person who was not part of your household. The ban on meeting in houses of worship were prolonged. Social events were prohibited. Some restrictions were eased. Shops with a retail square of up to 800 square metres were allowed to reopen. Car dealers, bike shops and bookstores were excluded from this restriction and were allowed to open their doors regardless of size. But amazingly, no matter whether a crocheted scarf or a clinical face mask is used, masks became mandatory. So mandatory masks. There is simply a lack of clear evidence that people who are not ill or who are providing care to a patient should wear a mask to reduce influenza or COVID-19 transmission. We are not aware of any single scientifically sound and undisputed article that would contradict the following. There is no scientific evidence that symptom-free people without cough or fever spread the disease. Simple masks do not and cannot stop the virus. Masks do not and cannot protect from infection. Non-medical face masks have very low filter efficiency. Cotton surgical masks can be associated with higher risks of penetration of microorganisms, penetration 97%, moisture retention, reuse of cloth masks, and poor filtration may result in increased risks of infection. Since the government enforced the use of masks, many elderly people believed that they were safe while wearing them. Nothing could be further from the truth. Wearing a mask can entail serious health hazards, especially for people with pulmonary disease and cardiac insufficiency, for patients with anxiety and panic disorders, and of course for children. Even the World Health Organization originally stated that general wearing of masks did not serve any purpose. What did the RKI say? In accordance with the shift in political opinions, they also changed their previous recommendation and supported mask wearing. If people, even without symptoms, wore masks as a precaution, it could minimise the risk of infection. Of note, that is not significant. This is not significantly documented. A report claiming that mask wearing had provided positive effects was basically flawed. According to the study, the effects drop in numbers of infection became apparent 3 to 4 days after implementation of the regulation. However, this is impossible. The RKI states an effect of the representative measures can only be seen after a delay 2 to 3 weeks, because on top of the incubation period up to 14 days, there is a time delay between illness and receipt of the reports. In fact, there is no study or even suggests that it makes any sense for healthy individuals to wear masks in public. One might suspect that the only political reason for enforcing the measure is to foster fear in the population. Last argument for extension of lockdown, the impending second wave. The constant fear spreading, experts of the government obviously pursue the same goal. In Germany, Dresden warned again and again, and somehow it seemed as if every country had its own Dresden. At the end of April, he again fantasized about the big time wave in Germany. Now, of course, the second big wave. Would the R value through carelessness be once again more than I, and thereby exponentially increase virus spread? This would likely have devastating consequences, since the wave of infection would start everywhere at the same time. It would have a different momentum, but where should this second wave of infection come from? Dresden, we can learn this from the Spanish flu. It started at the end of the First World War, and most of the 500 million victims died during the second wave. That is true. But at the time of the Spanish flu, and antibiotics were not available to treat secondary bacterial infections that were the main cause of death. Consequently, people of all ages died Whoever compared COVID-19 to the Spanish flu is either completely clueless or deliberately intends to spread fear. It is clear that viruses change but do not simply disappear. Just as there has always been a flu season, there has also always been a coronavirus season. Here we see the typical course of a coronavirus epidemic. Does this look vaguely familiar and reminiscent of our RKI data with the March peak? But wait, this Finnish study stems from 1998. So if any government should decide they want a second wave, all they need to do is radically increase the number of tests in the annual coronavirus season. This simple manipulation will not fail to trigger the next laboratory pandemic. So relaxing the restrictions with the emergency brake applied. Professor Stefan Homburg, director of the Institute of Public Finance at the University of Hanover, never tired of explaining why the RKI numbers themselves called for immediate termination of all measures. Here, he was not the only one. Several others raised their voices, but critical opinions were completely ignored. Why? Did the government have an exclusive contract with Drosten, who keeps on warning and warning? By loosening restrictions, Germany will risk losing its lead in the fight against the pandemic. But eventually the time arrived. The beginning of May witnessed a cautious reopening of schools, shops and daycare centres would soon be able to admit children again. So I'm just going to show you the scale. This is the coronavirus, and I'll show you like a chart. You can see that. So contact restrictions were slightly relaxed and life was restarted, but at a painfully slow pace. But the RKI warns and warns. The reproduction factor is more than once again. It's at 1.1 to be exact. Horror of horrors, where were we too rash? Many were puzzled that the daily R factor fluctuated erratically. This, of course, was due to generally unknown fact that when infection numbers are very low, the R factor can be manipulated. It will simply be can be manipulated at will, simply by altering the number of tests conducted. And then the great scare. Do we possibly have excess mortality? Excess mortality, really? Could it possibly have anything to do with the collateral damage involved by the unwarranted measures? This question was posed by a senior member of the Risk Analysis Division at the German Ministry of the Interior. He produced a remarkable document in which the risk of collateral damage were meticulously analysed. He arrived at the conclusion that the measures were excessive and that they caused immense and irreparable collateral damage without providing any true benefits. The synopsis of the paper was sent to 10 external experts, including ourselves, to have the numbers checked. He then attempted to present the document to the minister unsuccessfully. He then sent the document to his colleagues in risk assessment divisions around the country and was suspended for his efforts. He stated in a press release that we considered the conclusion of the paper to be very important. The ministry ridiculed the document saying that it was no more than a private opinion. The media chimed in and considered the case closed. I will stop there now because this video is 20 minutes and we will continue in another video.